Good morning to those who attending our lectures, and today there is a fourth lecture dedicated to the description of cases of violation of medical ethics and human rights in experimental studies. Here we go. History of the legal framework for experimental research in medicine. The ancient Roman physician and scientist Celsus discussed the question, is it permissible to experiment on a person or in a living being in general? His answer was following. For purely scientific reasons, experiments are inappropriate, since the suffering of the living being subjected to experience will distort normal life phenomena. Other ancient scientists undertook such studies. In particular, Erasistrats spent them on slaves and animals. And here is a fact that characterizes the solution of this issue in 16th century. Then the French King Henry II was hit in the eye with a spirit at a tournament. Doctor subjected 4 criminals sentenced to death to exactly the same wound in order to be able to examine their wounds. The founder of anatomy, Andreas Vesalius, constantly confirmed his studies on corpses to the experiments on living animals. At the same time, he specifically stipulated that, obeying the dictates of the church, vivisections can only be carried out on dumb animals. Dr. Moll, the author of fundamental work, Medical Ethics, highlights the following point of the problem of interest to us. First, in medical research are there many that do not raise a difficult ethical question, taking here blood from microscopic examination, and so on. The second one, sooner or later, the clinical innovation must be applied to the first patient. The doctor in first situation should bear in mind the question of the consent of patient to such studies. The first special ethical legal verdict governing human experimentation was a decree issued in Prussia in 9000. In such, the history of formation of the legal basis for experimental research in medicine began at the Nuremberg trial in 1945 to 46. Then it became known that Nazi doctors, contrary to the Hippocratic oath they had taken, performed villainous experiments on people, killing 70,000 people who were considered useless for their society. It was at the Nuremberg trials that the world first questioned the integrity of doctors and medical ethics. The Nuremberg trial in the doctor's case took place from December the 9th in 1947 to August the 20th, 1947. This trial was the first in a series of 12 subsequent Nuremberg trials. 20 consultation came doctors, as well as 1 lawyer and 2 officials, were accused of medical crimes. The official title of the trial in USA with Karl Brandt, named after one of the main defendants. Like the other 11 small trials, the doctors' trials were conducted by the tribunal set up by the U.S. military command. There were no representatives of the other victorious powers. The hearing took place in a conference room 600 of one of the Nuremberg Palace of Justice, which was part of the American occupation zone. On the 23 defendants, 7 were sentenced to death, 5 to life imprisonment, 4 to various prison terms from 10 to 20 years, and 7 were acquitted. The main charges were forced medical experiment, the murder of prisoners for the anatomical collection of August Hirt, experiments with infections of typhus, malaria, tuberculosis and hepatitis, forced euthanasia, forced sterilization, studies of the effect of low blood pressure, hypothermia, and seawater on the body. On the basis of the Dachau concentration camp, the medical laboratory, the pressure chamber was deployed, in which air pressure was simulated at different heights, up to 10 kilometers. Of more than 200 prisoners involved in the work of the Zygmunt Rusher, then 80 people died. From the very beginning, Rusher research went into direction, the study of mechanism of human freezing and the conditions for death from cold from the point of view of physiology, and the study of methods of warming frozen people in order to choose the best option. From March 1941 to January 1945, experiments were carried out in the concentration camps of Auschwitz and Ravensbrück on sterilization by X-rays, surgery, and various substances. The goal was developed a sterilization method that would suit millions of people at minimal cost and time. In Buchenwald concentration camp, experiments were carried out to establish the effect of various poisons, which were secretly introduced into the food of the experimental subjects. Victims died as a result of poisoning or were immediately killed for autopsy. Towards the end of the World War II, test subjects were shot of poisoned bullets. As a result of experiments to establish the effectiveness of typhoid and other vaccines in Buchenwald, more than 90% of subjects died. Healthy prisoners were placed in a pressure chamber, infected with mosquitoes or injections of mosquito salivary gland extract, and then treated. Other subjects were deprived of food and given chemically treated seawater instead. The blood of children was used to treat German soldiers in military hospitals. According to the historian Zaleski, the rate of blood sampling was extremely high. Sometimes they even took all the blood. Experiments with mustard gas and phosgene. Mustard gas and phosgene are the chemical weapons. The influence on people was studied in Natzweiler-Stutthof concentration camp by Professor August Herd and Otto Bickenbach. Experiments were about 220 people. Of these, 40 were Russian prisoners of war. The rest are Poles, Czechs, and Germans. A total of 50 people died from these experiments. Some of the test subjects were partially blind. Experiments on the study of transplantation of bone fragments as well as modeling and methods of treatment of phlegmon and gangrene. The assassination and subsequent death of the head of Protectorate of Bohemia in Reinhard Hardy due to the wound infection drew the attention to the leadership of the Third Reich to her. The number of experiments were carried out on healthy Polish women from the Ravensbrück concentration camp. By implanting various non-sterile foreign objects in their limbs, gas, gangrene, and other infectious diseases were artificially induced in them, which were then treated with sulfanilamide. To avoid the spread of the infection, blood vessels were tied off from both edges at the wound. Ravensbrück also carried out a series of experiments on bone grafting, muscle and nerve regeneration, futile attempts to transplant limbs and organs from one victim to another. Euthanasia or killing program T4. One of the main points of indictment at the Nuremberg trials in case of doctors was euthanasia, the T4 killing program. This program envisages the framework of racial hygiene, the purification of Aryan race from people whose existence, according to the prevailing for that moment ideas, influenced the appearance of healthy offspring. First of all, This affected patients of psychiatric clinics, as well as those persons with mental disorders who were identified through outpatient doctors and private psychiatrists. The Auschwitz experiments were led by Joseph Mengele, so-called Dr. Mengele. Prisoners called him the Angel of Death. Tens of thousands of people became victims of his experiments, castration and sterilization of people, testing endurance with cold, temperature, pressure, radiation, implantation of dangerous viruses, and much, much more. It is noteworthy that all experiments were carried out on prisoners without anesthetics. He had a laboratory and a dozen professors and doctors who selected children and twins. The twins received blood transfusion and transplanted organs from each other. Sisters were forced to have children from brothers. Sex reassignment operations were carried out. There have been attempts to change the color of child's eyes by injecting various chemicals into the eyes, amputating organs, attempting to sew children together. He dissected live babies, tested women with high voltage shock to find out the limit of endurance. Of 3,000 twins who came to Mengele's, only 300 survived. His name had become the household name for killer doctor. Then Soviet troops approached Auschwitz. Mengele managed to escape, moved with a fake passport to Latin American countries. They there under an assumed name for more than 30 years and died a natural death in Brazil in 1979. Only later was the exhumation of the corpse carried out, confirming that it was Mengele. The ideas of racial hygiene and eugenics, from the Greek word eugenes, a good, kind, well-bred, were born not in Germany but in Great Britain in the second half of the 19th century. At the same time, the main ideas of social Darwinism were formed. The founder of the eugenics is the British Francis Galton, who in 1865 published the work Hereditary Talent and Character, and in 1869 the book Inheritance of Talent. In Germany, eugenics was just taking its first step, and it was already being actively introduced into life in a number of countries. In 1921, the Second International Congress of Eugenics was magnificently held in New York. This was the first one held in London in 1912. In academic circles, two main directions of this science have formed, so-called positive and negative eugenics. The first means the reproduction of the improved member of human society who did not have hereditary diseases and were distinguished by good physical development and high intelligence. The second was aimed at limiting the birth rate of the lower representatives of the human race who had hereditary defects and were racially or mentally handicapped. Interestingly, that Russian Eugenic Society formed in 1920 recognized only positive eugenics. In 1921, the textbook of genetics was published in Germany, written by Bauer, Fischer, and Lanz. A significant section of this book was devoted to eugenics. According to the supporters of this science, the most important role of the formation of personality is played by his heredity. Obviously, upbringing and education also have a huge impact on the human development, but nature plays a more important role. This leads people to be divided into worst, the low level of intellectual development. Some of these people have an increased level of propensity for crime. In addition, the worst breed much faster than the best, highest representatives of humanity. The second edition of the book appeared in 1923. The publisher was Julius Lehmann, Hitler's comrade. He had the future. He had the future leader of Germany hiding after the beer coup. After thundering into prison, Hitler received books from Lehman, including a textbook of eugenics. As a result, a section devoted to human genetics appears in Hitler's book My Struggle. The National Socialist Party won a significant percentage of the vote in 1930 elections. Lanz wrote a review of Hitler's Mein Kampf. It was published in one of the German scientific journals. This article noted that Adolf Hitler is the only politician in Germany who understands the meaning of genetics and eugenics. In 1933, Hitler believed the German geneticists. They promised the fervor that within 20 to 40 years they would raise a new person, aggressive and obedient to power. The conversation was about cybers, the biological soldiers of the Third Reich. Hitler was on fire with this idea. During one of the lectures, Alfred Blotz in Munich, a scandal erupted. Then asked what the doctor proposes to do to the sick people, Blotz answered, sterilize them or kill. And what exactly is the purpose of eugenics? Measures to clean up the German race were elevated to state policy of the Third Reich with the introduction of two laws, the law on the citizen of Reich and the law for the protection of German blood and German honor. However, few people know that such laws were not only in Nazi Germany but also in other European countries. For example, in Sweden, moreover, the Nuremberg Tribunal did not affect them in any way, and the idea didn't come from Germany. The struggle for the purity of the race unfolded here in the north of Europe quite independently. The only difference between the Swedish welfare society and the Nazis was the Swedes did it longer. Eugenics was invented not by Hitler but by doctors. They wanted good for the German people, but it all ended the concentration camps and experiments on people. Some researchers believe that doctors incited German leaders to Nazism. At the time, then this term didn't yet exist. They began to practice eugenics, which in Germany was called the racial hygiene. Then, and Hitler and his associates came to power, it became clear that it would be possible to sell the idea of racial hygiene. From the book of Professor Brill, Science and the Swastika, after coming to power, the actively supported the development of German medicine and biology. Funding for scientific research had increased tenfold, and doctors have been declared an elite. In Nazi state, this professor was considered the most important, since its representatives had to be responsible for the purity of the German race. The eugenic professor developed the law of racial purity. According to the laws, Jews did not have the right to work at schools, state institutions, and teach at universities. First of all, according to the doctors, it was necessary to clear the scientific and medical ranks from the Jews. Science was becoming an elite closed society. In the mid-1920s, Germany had the most advanced science. All scientists and doctors who worked in the field of genetics, biology, obstetrics, and gynecology considered it prestigious to take an internship in Germany. Then, the third of the doctors were Jews. But after a great purge in 1953 and 1935, German medicine became completely Aryan. According to Nazis Yevgeny, the world was originally divided into healthy and unhealthy peoples. This was confirmed by data from genetic and medical studies. The task of eugenics is to save humanity from disease and self-destruction. According to these German scientists, Jews, Slavs, Gypsies, Chinese, Negroes in other nations in an inadequate sex, weak immunity, and an increased ability to transmit diseases. The salvation of the nation is in the sterilization of some people and the controlled birth rate of others. In the mid-30s, in a small estate near Berlin, where was a secret facility. This is the first medical school patronized by Rudolf Haas, the Hitler's deputy. Every year, medical workers, obstetricians, and doctors gathered there. It was not possible to come to school of one's own free will. The student was selected by Nazis, the party. SS doctors selected cadres who took refresher courses at this medical school. This school trained doctors to work in concentration camps, but at first this personnel were used for the sterilization program of the second half of 30s. In 1937, Karl Brandt became the official boss of German medicine. This man was responsible for the health of Germans. According to the sterilization program, Karl Brandt and his subordinates could get rid of mentally ill people, disabled people, and children with disabilities with the help of euthanasia. Thus, the Third Reich got rid of extra mouths, because military policy does not imply the presence of social support. Brandt fulfilled his task. Before the war, the German nation was cleansed of psychopaths, invalids, and freaks, then destroyed more than 400,000 adults, and for the first time used gas chamber. It is believed that for the first time German fascists began to widely practice eugenics, sterilizing and killing representatives of the lower races, as well as crazy and homosexuals. In a word, anyone who could spoil the Aryan gene pool. But it turns out that the selection of people was widely carried out much earlier and in quite democratic countries where the sterilization of genetically defective people was often carried out even without their consent. Alice, the German were not the first to divide people into higher and lower genetic data. The first law to sterilize people with congenital disabilities was passed in the United States in 1907, 23 years before the similar law was passed in Nazi Germany. Previously, first page of the country's history was hushed up. Only recently, the Library of Congress published a series of photographs telling about the development of eugenics in the United States. And in 1931, the law on the sterilization of mentally ill was introduced into the British Parliament. The goal was the same, to improve the gene pool of the nation and rid of genetic garbage. In 1907, the Society for the Study of Eugenics in Britain organized a campaign for the sterilization and restriction of marriage for certain categories of the population in order to prevent the generation of population. The year later, Sir John Churchill Brown proposed the mandatory sterilization of the feeble-minded. Winston Churchill backed him. And in 1931, this proposal, already in the form of a bill, was submitted to the country's parliament. The state of Indiana was the first to agree to the forced sterilization of mentally handicapped citizens in 1907, and by 1938, already in 33 American states, mentally handicapped women were forcibly sterilized, and in 29 people with certain congenital genetic defects were also sterilized. Often patients were not even told what kind of operation they were undergoing. In 1920s and 30s, other countries also adopted laws on sterilization. These were Sweden, Denmark, Norway, and Finland. On July 14, in 1933, the Nazis issued a decree on preventing the appearance of hereditary ill offsprings, which became an instrument of Germany's socio-demographic policy. Now the authorities could safely sterilize any socially unsuitable people, opponents of new regime, homosexuals, lesbians, sex offenders, perverts, and even those who committed adultery. Forced sterilization of Roma women was carried out in Czech Republic in a period from 1979 to 1989. Similar operations were forcibly carried out in Switzerland until the late 1980s. Mentally retarded and gypsies fell under the law. However, experiments in eugenics gained the greatest scope in prosperous Sweden, where people were forcibly sterilized from 1934 to 1976. During this period, more than 63,000 people were sterilized in accordance to the purity of race law. The law was repealed only in 1976. Sweden was the first country in the world to establish a state institute for racial biology. In the United States, by 1939, 30,000 citizens were operated on. The United States government encouraged the sterilization of Indian women and black women. Then they got to the hospital for various reasons. They were sterilized without their knowledge. In one state of California, in a period from 1909 to 1964, 20,000 people underwent the operation. In North Carolina, 8,000 citizens were sterilized by 1973. In the United States, sterilization as a part of eugenic policy continued until 1974. Forced sterilization has been widely practiced in China and India. In 1970s, as part of one family, one child policy, officials in certain Chinese provinces sterilized women. Today, this practice is not used, but in 2010, the Pune city authorities were accused by Amnesty International of forced sterilization of that town's people. From 1975 to 1977, India had a forced sterilization program that affected 10 million of Indian women. Plus, the Gandhi government tried to hide poverty in the big cities. Sterilization laws were in effect in Japan from 1948 to 1996. Under this law, on eugenics fell 25,000 people, of which most of the procedure was done by force. The Nuremberg Principles, also called the Principles of International Law, recognized by the Statute of Nuremberg Tribunal and found expression in the decision of this tribunal. They represent a set of fundamental legal principles that characterize acts that, in accordance with international law, are crimes against the peace and security of humanity. So these principles are: first principle, any person who commits any act recognized as a crime under international law is responsible for it and is liable to punishment. Second one, the fact that domestic law does not impose the penalty for any act recognized as a crime under international law does not relieve the person who committed that act from liability under international law. Third one, the fact that a person who has committed an act recognized as a crime under international law has acted as head of state or responsible government officials does not relieve such person from liability under international law. The fact that, fourth one, the fact that a person acted in pursuance of the order of his government, a superior, does not absolve that person from liability under international law if a conscious choice was in fact possible for him. And the fifth principle, every person charged with an international crime has the right to fair trial on the basis of fact and law. Sixth principles. The crimes listed below are punishable as international crimes. These are crimes against peace, planning, preparing, initiation, or waging a war of aggression or war in violation of international treaties, agreement, and assurances. Participation in a common plan or conspiracy to carry out of the act referred to in paragraph 1. War crimes. These are violation of laws and customs of war and including but not limited to killing, ill-treating, or taking into slavery or for other purposes the civilian population of an occupied territory, killing or ill-treating prisoners of war or persons at sea, killing of hostages or looting public or private property, the senseless destructions of cities and villages, or their ruin not justified by military necessity. Crimes set out below are punished as crimes under international laws. Crimes against humanity. These are murder, extermination, enslavement, expulsion, and other inhuman acts committed against the civilian population or persecution on political, racial, or religious ground, if such acts are committed or such prosecutions take place in a performance of or in connection with any crime against peace or any war crime. Seventh principle. Complicity in the commission of the crime against peace and war crime or crime against humanity under principle 6 is a crime under international law. One of the most important provisions of the Nuremberg Code was the ban of experiments on humans without their voluntary consent. The Nuremberg Code, established in 1947, it has 10 essentials. An absolutely necessary condition for conducting an experiment on a person is the voluntary consent on the latter. Second one, their experiment should bring positive result to society, unattainable by other methods or methods of research. It should not be random, inherently optional. Third one, their experiments should be based on data obtained in laboratory studies on animals, knowledge of the history of the development of this disease or other problem under study. Its implementation should be organized in such a way that the expected results justify the very fact of its implementation. Then conducting an experiment, all unnecessary physical and mental sufferings and damage must be avoided. No experiments should be conducted if there is a priori reason to believe that the subject may die or be incapacitated. An exception, perhaps, may be the cases where the medical researchers act as test subjects in their own experiments. The degree of the risk associated that conducting an experiment should never exceed the humanitarian importance of the problem that the experiment is aimed at solving. Seventh, the experiments must be preceded by appropriate preparation, and its conduct might be provided with the experiment necessary to protect the subject from the slightest possibility of injury, disability, or death. The experiments should only be carried out by persons of scientific qualification. At all stages of the experiment, those who conduct it or are involved in it require maximum attention and professionalism. During the course of the experiment, the subject must be able to stop it if, in his opinion, his physical or mental condition makes it impossible to continue the experiment. During the course of an experiment, the investigator in charge of conducting it must be prepared to terminate the experiment at any stage if professional consideration, good faith, and cautioning judgment are required of him or her to suggest the continuation of the experiment could result in injury, disability, or death to the subject. There is also adopted the Declaration of Helsinki, the World Medical Association Declaration of Helsinki. This provides guidelines for physicians on biomedical research in human. First of all, human studies should be based on previous laboratory and animal experiments. The experimental protocol must be peer-reviewed by an independent committee. Informed consent is necessary. Participation of minors and people with physical and mental disabilities is restricted. Research should be carried out by scientifically medical qualified personnel. Risk-benefit balance should be established. Non-interference in the private life of the subject is essential. Publication of the result of the scientific research is mandatory. The international regulation of the right of the patients and problems of biomedicine include International Code of Medical Ethics, European Charter of Patients' Rights, Medical Code of the New Millennium, International Project, Lisbon Declaration on the Right of the Patient, International Code of Medical Ethics, Declaration of Helsinki as well. Universal Declaration of Human Genome and Human Rights, Universal Declaration on Bioethics and Human Rights, Declaration on Human Cloning, adopted by United Nations Organization, Convention for the Protection of Human Rights and Dignity with regard to application of biology in medicine, and Convention on Human Rights and Biomedicine. And there are also some additional protocols to it concerning the prohibition of human cloning, transplantation, and biomedical research. Our country at one time did not support either the Nuremberg Code or the Helsinki Declaration. Only at the turn of present and last centuries, Russia began to develop its own standard for the supervision of clinical trials. In 2005, Good Clinical Practice was released. Later, in accordance with that, the federal law on medicines and on the fundamentals of protecting the health of citizens were issued. Independent bioethical committees, which have been operating at all medical research institutions since the late of 1990s, are guided primarily by the European documents and not by the national GOST or Good Clinical Practice. According to Good Clinical Practice in Russian GOST, the first phase of clinical trials of the drug, then the tolerability of the active substances assessed, is always carried out on healthy volunteers, even when it comes to highly toxic substances such as chemotherapy drugs for cancer or AIDS. Russian bioethics committees generally do not allow researchers to take such risk and recommend, in accordance with European standards, to replace healthy subjects with patients to the first stages of relevant diseases. And first, it is not the only situation in which domestic researchers slow show increased caution. Scandalous cases of violation of medical ethics. Marion Sims Guinea slaves. In New York until 2018, where was a monument of James Marion Sims, a surgeon who found a way to treat the terrible consequence of difficult birth, the vaginal fistula. But in our time, the monument was removed. This was the result of the long debate in society whether to consider him a genius who wanted to make life easier for women, or a monster who viewed women as an expendable if they were of the wrong color. Marion Sims is considered one of the fathers of modern gynecology. It was he who first learned how to perform an operation to remove vaginal fistulas. True, not everyone knows that black slaves helped him master this technique. Of course, no one asked the consent. They were women who asked the doctor to take them into his research, but Sims refused. He was sure that decent ladies would not endure such pain. From 1845 to 1849, 12 young black girls became guinea pigs, but the names of only 3 of them have survived: Betsy, Honorca, and Lucy. Each had to endure more than a dozen operations, and the main experimental Honorca about 30. At the same time, since doctors used anesthesia in those days, the Great Apprehension, all operations were performed without anesthesia. Sims was sure that dark-skinned women hardly feel pain, and therefore they were convenient material for research. Dr. Walter Jones recommended boiling water as a cure for abdominal pneumonia in 1840s. He tested his method for several months on numerous slaves suffering from this disease. Jones described in great detail how one patient, a 25-year-old man, was stripped naked and forced to lie on his stomach on the ground, and then Jones poured about 22 liters of boiling water on the patient's back. However, this wasn't the end. The doctor stated that the procedure should be repeated every 4 hours, and perhaps this would be enough to restore the capillary circulation. Jones later claimed to have cured many patients in that way, and claimed to have never done anything himself. Another pioneer of American medicine, Dr. Arthur Wentworth, was introduced a metal nail into the spinal cord of 29 children, the so-called lumbar puncture, to test how harmful it was. Moreover, the parent of the children did not even know what kind of experiments the doctor put on their children. In 1896, the pediatrician Arthur Wentworth decided to test the obvious. During an experimental lumbar puncture performed on a young girl, Wentworth noticed how the patient cringed in pain during the procedure. He suspected that the operation was painful. At that time, for some reason, it was believed that it did not hurt. But he was not completely sure, so he did a few more procedures on 29 babies and toddlers. In the end, he came to the conclusion that the procedure, although painful, is nevertheless very useful as it helps to diagnose the disease. Wentworth's findings received mixed reviews from colleagues. Some praised him, but one of the critics stated that it was nothing more than the dissection. Growing public resentment on experiments later forced Wentworth to leave his teaching job at Harvard Medical School. Dermatologist Albert Klingen tested the complex experimental program on inmates at Holmesburg Prison in the 1960s. One of these experiments, sponsored by the U.S. Army, was aimed at increasing the strength of the skin. Theoretically, hardened skin could protect soldiers from chemical irritants in war zones. Kligman applied various chemical creams and remedies to the prisoners, but the only result were numerous scarring and pain. Pharmaceutical companies also hired Kligman to test their products. They paid him to use prisoners as hamsters. Of course, the volunteers were also paid, albeit little, but they were not fully informed of the possible adverse events. As a result, many chemical mixtures have led to skin blisters and burns. Kligman was a completely ruthless man. He wrote, "When I first arrived at the prison, all I saw in front of me were endless acres of skin." Eventually, public outrage and the ensuing investigation forced Kligman to stop his experiments and destroy all information about them. Unfortunately, the former test subjects were never compensated for their damages, and Kligman later made a fortune by inventing retin A and acne treatment. The Tuskegee study was an infamous medical experiment that ran from 1932 to 1972 in Tuskegee, Alabama. The study was conducted under the auspices of the U.S. Public Health Service and aimed to investigate all stages of syphilis in 600 poor African American sharecroppers, of which 201 were not infected with syphilis before experiments on them. By 1947, penicillin had become the standard treatment for syphilis, but patients were not told about it. Instead, scientists continue their research, hiding information about penicillin from patients. In addition, the researchers ensured that study participants did not access to syphilis treatment at other hospitals. The study continued until 1972, then a press leak led to its termination. As a result, many people suffered, many died from syphilis, infecting their wives and children born with congenital syphilis. The U.S. government in 1997 officially acknowledged the existence of this experience and apologized to the people of Tuskegee, and Bill Clinton, then he was a president, personally apologized to them on behalf of the nation. In 1949, Operation Green Run was carried out in Washington state, in which an area of 2,000 square kilometers was contaminated with radioactive isotopes of iodine and xenon. 3 small towns were located on the territory at once, but these did not stop the military. In 1953, the American Atomic Energy Commission at the University of Iowa conducted experiments on pregnant women. They were exposed to radioactive iodine to induce an induced abortion. In another experiment, AEC staff fed radioactive iodine to 25 newborns. In another experiment, to 65 infants. Later on, researchers at the University of Rochester gave 6 subjects small doses of the uranium to find out how much radiation their kidneys could withstand. From 1945 to 1947, as part of the Manhattan Project, 16 people received injection of plutonium. One of them was Albert Stevens, who was deliberately given a false diagnosis of stomach cancer and began to treat with injections of plutonium. The ashes left after Albert's cremations are stored in several research institutions. They are still radioactive. To see how radioactive materials crossed the maternal placenta, in the mid-1940s, researchers at Vanderbilt University gave 829 pregnant women to drink a solution of radioactive iron salts. At the same time, women were told that it was a vitamin drink. Some newborns, like their mothers, developed cancer and died. From 1948 to 1954, scientists at Johns Hopkins Hospital inserted radium rods into noses of Baltimore school children as a part of government program. In total, 582 school children underwent this procedure of treatment of adenoids. For 12 years, from 1960 to 1972, the American physician Eugene Singer, commissioned by the U.S. Department of Turnover, conducted a study at the Cincinnati Central Hospital, the purpose of which was to learn the effect of radiation on people. Singer's victims were hundreds of people, mostly poor African Americans, suffering from cancer. 89 of them died a painful death. Instead of anti-cancer drug, these unsuspecting people received radioactive preparations containing high doses of radiation. Singer was never punished. Until the end of his life, he was convinced of the need for his experiments, believing that they ensured the readiness of the country for the nuclear war. During the famous Manhattan Project, 18 people were injected with plutonium. This was long before the atomic bombing of Hiroshima and Nagasaki. The American government wanted to know in advance about the long-term effect of atomic explosion on the human body. The experiments were carried out in Tennessee on military personnel who were injected with plutonium in minimal dosages. In 1954, as part of Project Bravo, the Americans dropped a nuclear bomb on Marshall Islands, as a result of which 236 local residents were specifically exposed to radiation. One of them died, the rest fell ill with radiation sickness. In 1957, the military detonates another nuclear bomb in Nevada. By some estimates, this resulted in between 1,000 to 20,000 deaths in ordinary Americans who were hit by the radioactive cloud. Psychological experiments. The Project Blue Bird. In 1947, the CIA, with the help of German scientists, began work on creation of truth serum. This, at first glance, an innocent occupation turned into a real nightmare, and from 1951 to 1953, the CIA was actively working on Bluebird project, the essence of which was to gain mind control. The psychiatrists involved in the project performed countless human experiments. Scientists tried to create a new personality in a person's head, or to bring the poor fellow to amnesia. Post-hypnotic commands and false memories were attempted to enter the subject's mind. Work was underway to create multi-personality. In addition, the main task included bringing the brain of the object to such a state that the person could be controlled by just switching the remote transmitters. The methods the CIA used to achieve its goal were not always humane. For example, as a part of the project, experimental children were forced to take LSD 25 daily, and electroshock therapy was supposed to help people lose their memory. How much suffering are we willing to inflict on each other if there is someone who will take all the responsibility? This question was asked by the psychologist Stanley Milgram in Yale University. The scenario of the experiment was as follows. 3 people participated in the experiment: the subject, so-called teacher, the actor, student, and the researcher. The subject believed that both participants, both the teacher and student, were equal, and the researcher was responsible for the experiment. 2 subjects had to draw lots to determine which of them would be the teacher and which would be the student. In fact, the actor always got the role of the student. It was the responsibility of the teacher to make the student complete simple memory task. In that time, the student was tied to a chair of electrodes. For each mistake, the teacher had to punish the student with a 45 volts electric shock, gradually increasing the voltage by 15 volts after each mistake, reaching 450 volts. Although there was no current in the experiment, the actor very plausibly paid thus discomfort and then real pain, and at voltage of 150 volts, the student demanded to stop the experiment. At this point, the researcher stepped in, demanding that the teacher continue the experiment at all costs. The researcher assured the student that he took full responsibility for the life and safety of the student. The result of the experiment shocked Milgram, who had previously assumed that only the German had a penchant for unquestioning obedience. It turned out that this feature does not depend on nationality. In one series of experiments, 26 out of 40 subjects dutifully increased the tension of the voltage until the researcher ordered them to stop torturing the victim. Almost none of the subjects asked to stop the experiment and did not refuse their role. None stopped before the voltage of 300 volts. At this point, the victim began to yell, "I can't answer questions anymore." In Project Aversion, the current was real. A psychological experiment led by Colonel Aubrey Levin, which lasted 18 years, left behind thousands of crippled destinies and bodies. Torture practice in the South African army was aimed in changing the orientation of homosexual soldiers. The instrumentation was very diverse: narcotic drugs, electroshock therapy, chemical castration, surgical sex change. Prior to 1973 of the last century, homosexuality was recognized by the American Psychiatric Association as a mental disorder. It was believed that this is a disease that can be cured. Subjects were shown black and white photographs of naked men, but as soon as they showed the slightest signs of arousal, the victim were shocked. After that, the men were shown color photographs of women, hoping to encourage sexual reaction to them, but there was no arousal on the part of homosexual men. By the way, there were also women among the patients. In the description of the experiments, there is a case that the current discharge was so strong that the patient's shoes flew off the patient's head. It was very traumatic. I didn't think her body could handle it, admits one of the intern participating in the experiments. In the United States, homosexuality ceased to be considered a disease in 1973, but in South Africa, this decision was not supported and experiment continued. Experiments on prisoners. Dr. Duff and mockery of prisoners. From 1915 to 1951, the chief surgeon of San Quentin, California prison, Dr. Leo Stanley, conducted hundreds of experiments on prisoners. He believed that men who committed crimes had low testosterone level. According to him, increasing testosterone levels in prisoners will lead to a decrease in criminal behavior. Dr. Leo Stanley was the chief surgeon of the famous American prison San Quentin. During his service, he conducted many terrible experiments on prisoners, including an experiment of testicular implantation. Stanley later explained that in this way he was trying to find a way to rejuvenate and produce people's craving for cruelty. True, he did this tragedy. He took the testicles of executed criminals as well as testicles of rams, goats, boars, and sewed them into the convicts. Naturally, rejection began, often with complications. Then Stanley changed the tactics and began to give injections to prisoners, grinding the testicles of animals in mashed potatoes. He injected into the muscles of unfortunate. These were real tortures, although Stanley himself believed that the suffering of prisoners in this case is for benefit of all mankind. Bacteriological studies were also carried. In the mid-1880s, the California doctors working in Leper Hospital in Hawaii infected 6 underage girls with syphilis virus for scientific purposes. Not far from him, the New York pediatrician Henry Hyman, who deliberately infected 2 mentally retarded boys with gonorrhea, did not go far. In scientific literature of 19th or 20th century, about 40 experiments of this kind are described. Then doctors intentionally infected children with venereal diseases. But venereal diseases seem like flowers. If you remember the story of how American military doctors infected 5 Filipino prisoners with bubonic plague. In 1906, Harvard University professor Richard Strong infected 24 Filipino prisoners with cholera. 15 of them had died. In 1908, 3 Philadelphia doctors infected dozens of the orphans with tuberculosis, causing some of them to become blind. In the published results of the research, these doctors called the children the crippled used materials. There are a great many cases of deliberate infections of prisoners, mentally retarded patients, and orphans. American doctors infected people with syphilis, molluscum contagiosum, malaria, herpes, hepatitis, transplanted them the cancer cells, and so on. Among the variety of medical disciplines, psychiatry is undoubtedly one of the most social in its subject matter, methodology, and practice. This is due to, firstly, characteristics of patients of practical psychiatry. Secondly, the complexity of diagnosis and wide range of mental disorders, from borderline adaptation disorders to pronounced chronic psychosis and dementia. According to World Health Organization, about 450 million people in the world have some kind of mental disorders. First, of the 3 million adults, 7 of every 1,000 people suffer from schizophrenia during their lifetime. According to statistics, approximately 1% of the world's population shows signs of schizophrenia. From 3 to 5% signs of mental retardation, and 5% have depression. There are even more patients with neurosis, personality disorders, alcoholism, and drug addictions. The ancient Greeks were quite harsh with mentally ill. They could even beat them with stones. Particularly possessed could be chained in stocks or put on electric ramp. The Romans suggested, make sure that there are no constipation with melancholy, bind and keep in the dark the violence and fury, give an emetic and bind death hallucinations and delirium. If it doesn't help, prescribe therapeutic fasting and healing Lilly recommended Celsius. The approaches to treatment of mental illness in medieval Europe were quite diverse. The sick were often kept in monasteries and used exorcism. Red hot iron and therapeutic eau de feu were used infrequently. For the treatment of melancholy, they offered to eat a pig's heart stuffed with medicinal herbs. Rods were also used in order to divert the material cause of mania. Mustard plasters for the, for the whole person in order to thin the blood stagnant during melancholy. Bloodletting and in act of unbridled humanism, worm buffs. In Switzerland, in an orphanage near Zurich, chains and daily distribution of wine were practiced for medicinal purpose. Hellebore water was used quite widely, both from lice on the heart and from cockroaches inside. In Europe of 18th century, they continued to actively use hellebore water and practice cold dosing. The British, instead of ropes and shackles, began to use a straitjacket, a prototype of the straitjacket. True onlookers are still allowed into Bedlam, 1 pence for entry, and on weekend it is sold out. The French, for the force of Francois Pinel, also refused to fill the sick in shackles and began to use straitjackets. By the beginning of 19th century, the style is still relevant today. In 19th century, doctors began to show greater interest in the mentally ill combined with and the fatigable fantasy. This is how a restrained chair, a restrained bed, and rotational bed and rotational machine appears. This is to make the blood rush to the head and the brain work better. This was the device for unexpected immersion in a pool of cold water, as well as an ice shower on the head from hose. Patients wrapped in large wet towels for hydrotherapy are shown in the middle picture. In the 20th century, in the first half, the treasury of methods for treating mental illness was replenished with malaria therapy. Progressive paralysis was treated with malaria vaccination, for which the inventor of the method, the Austrian psychiatrist Julius Wagner Jurek, received the Nobel Prize in 1927. And then these injections of sulfazine, as well as electroconvulsive therapy and insulin therapy, not counting the lobotomy. And finally, neuroleptics, antidepressants, and other contents of the magic psychiatry suitcase appear. We are waiting for vaccine against Alzheimer's disease in this 21st century, but the conscience vaccination and an intelligence potion, it is still tight. At this picture, you can see the so-called hydrotherapy. The Dutch physician and chemist Jan Baptist van Helmont came up with the effective way to rid the people of crazy thoughts and ideas. Hyperactive patients were prescribed boiling water, and inactive and inhibited patients to be treated with ice water. Lobotomy. The method of translobon leukotomy, also called lobotomy in an ice pick, developed in 1947 by the American Walter Freeman, which did not require drilling the patient's skull, and it was widely used. Freeman became a leading advocate for the lobotomy. He performed his first lobotomy using electroconvulsive therapy as an anesthetic. He aimed the narrowest end of the ice-picking surgical instrument at the eye socket bone, pierced a thin layer of the bone with a surgical hammer, and inserted the instrument into the brain. After that, the fibers of the frontal lobes of the brain were cut with the movement of knife handle. Freeman argued that procedure would remove the emotional component from the patient's mental illness. The first operations were carried out with a real ice pick. Subsequently, Freeman developed special tools for that purpose, so-called leukotomy. In fact, the entire operation was carried out blindly, and as a result, the surgeon destroyed not only the areas of the brain affected, in its opinion, but also the significant part of the nearby brain tissue. The first lobotomy in USSR was carried out in 1944. According to its own method, classed to the method of Egitz-Moniz, but lobotomy has not received such rivalry as in America. For all time, about 500 operations had been carried out. In 1949, very strict requirements were set for the elections of patients who were shown indicated such a procedure. A list of clinical neurosurgeons who had the right to perform it was complied. At the end of 1950, an order was issued prohibiting the use of prefrontal lobotomy in general. The resolution sounded like this: the refrain from using prefrontal leukotomy in neuropsychiatric diseases as a method that contradicts the basic principles of such treatment. Surgical treatment of insanity. Dr. Henry Cotton believed that underlying causes of insanity were localized infections. After Cotton became head of the Trenton Lunatic Asylum in 1907, he began to practice what he called surgical bacteriology. Cotton and his team performed thousands of surgeries on patients, often without their consent. Firstly, they removed the teeth and tonsils, and if this was not enough, then the doctor took a new step. They removed the internal organs, which in their opinion were the source of problem. Cotton believed in his methods so much that he even resorted to them in himself and his family. For example, he removed some of the teeth of himself, his wife, and 2 sons, one of whom also had part of the large intestine removed. Cotton claimed that his treatment resulted in high recovery rate for patients, and also that he simply became a lightning rod for those moralists who found his method appalling. Cotton justified the death of 49 of his patients during colectomy, for example, by the fact they were already suffering from terminal psychosis before operation. A subsequent independent investigation found that Cotton was grossly exaggerating. One of the most famous and most frightening treatments is electroconvulsive therapy or electroshock. It was first tested on patients in 1954, and in the following decades the popularity of the methods gained momentum. The Hungarian physician Lady Slamiduna noticed that patients suffering from schizophrenia get better after the convulsive seizure. Patients got rid of hallucinations, delusions, and incoherent speech. Meduna suggested that the same seizure, only artificially induced, could help overcome the disease and began using the drug coriazole therapy, which caused a seizure just a few seconds after taking it. The condition of the patient improved just before our eyes, and although the symptoms returned later, the doctor believed that this was a matter of duration therapy. History of psychiatry in Russia. For the first time in Russia, Peter I thought about the organized treatment of the mentally ill. Before that, no special measures were applied to mentally ill citizens. There were holy fools, but no one, of course, treated them. Until the 18th century, the mentally ill were under the care of monasteries. As psychiatrist Tikhon Yurin noticed, the history of psychiatry began with isolation in monasteries and prisons of all those who disturbed the peace of life, the sick as well as those who violated order on the street of the provincial city of those on trial. Nobody in this house, I didn't consider it medical institution, but only a place of detention for crazy rioters. As a result, psychiatric institutions were overflowing with alcoholics, debilitated vagabonds sent mainly by police. It is noteworthy that the laws adopted by Peter I were primarily aimed in combating the invasion of noble children from science and service under the guise of illness or foolishness. From now on, they had to undergo an examination of the actual manifestations of insanity. In 1855, the Russian psychiatrist Pavel Malinovsky published his work Insanity, in which he gives an accessible explanation of who can be considered insane. Here are the 8 signs by which you can distinguish a crazy person from the normal person. Inconsistency, that is, disagreement between words, facial expressions, looks, and gestures. Strangeness of body movements. Some of the patients in deep thought even talk the slow steps, then suddenly stop, as if they go even deeper into themselves and then begin to walk again. Others do not quickly change their position or sit for whole days. There are also such crazy people who lie curled up in a ball all their lives. Others crawl often or on their knees or on all fours like animals. The clothes. Most of those who are obsessed with clothes are careless, unclean. For many, it doesn't matter whatever they are dressed or not. Many have their hair in disarray. All their clothes are foreign, other somehow. Some patients dress in their own way with strange thrills. Facial expression. All crazy people always have rather strange special one. Between them you can see faces: sad, important, proud, joyful, ferocious, stupid. They all bear the stamp of insanity. Conversation. There are patients from whom not a word can be received in response because they don't want to answer, or having started a conversation and did not finish their thoughts, they suddenly plunge into deep thoughts. Others always speak in a barely audible whisper and answer to the side. Still others are either very talkative, but there is no connection in the words. Everything is confused. The conversation is interrupted. Desire to destroy. In all kinds of insanity, they have a desire to destroy everything that comes to hand and everything around. Often do it without choppy movements, coolly and monotonously, self-awareness and carelessness during illness. Malinowski refers to this signs as a state that patients forget about their illness and sorrows and do not care about their health during illness. One of the first psychiatric institutions, and the main principle of which was treatment, was founded in 1976 by the Kazan district in Zain Asylum. Dr. Pavel Ivanovich Jacobi, in his medical practice, pursued the principles of ideological and philanthropic policy. These are: the mentally ill are sick, psychiatric hospitals are hospitals, psychiatrists are psychiatrists, and it's a mistake to confuse them with the prison guards. Patients should be placed in the hospital, but not planted. There is no reason to treat the sick more cruelly than the healthy. The hospital has its task, the welfare of the sick, and not the convenience of the healthy. The mentally ill are suffering people and not rubbish. It is imprudent to do a work for which another is paid. Keeping a healthy person for a lunatic asylum for 2 years is just as wrong as planting him there for 2 hours. Then, analyzing the moral and ethical dilemmas that arise in the provision of psychiatric care, a number of problems specific to psychiatric practice had been identified. Some patients, due to the presence of the severe mental disorders, cannot independently express and defend their interest. The matter is also complicated by the existing difficulties of distinguishing between the norm and pathology, of the diagnosis of mental illness, the transfer of clinical assessment and terms to many variants of the industrial personality and social behavior of the person. There also were some famous celebrities with mental disorders. Among them were Abraham Lincoln, Vincent van Gogh, famous author Gogol, and Ludwig van Beethoven. Alfred Nobel, John Nash, writer Mikhail Lermontov, and Leon Tolstoy. Winston Churchill, Princess Diana, and Ernest Hemingway. In paternalistic model of the relationship between the doctor and the patient, the doctor takes full responsibility for making clinical decisions. On the contrary, the key category of the non-paternalist model is the category of patient rights. Undoubtedly, one of the features of psychiatry as medical science and practice is the extremely wide continuum of patient. It becomes obvious that for this category of patient, the paternalistic model is not the most appropriate and adequate. This does not mean completely ignoring the patient's opinion and forcing him to do something, although at decisive moment the doctor has the right to use the full power given to him, which of course should not remain without ethical control. At the same time, the consciousness and responsibility of the psychiatrist serve as a moral constraint. But other times the functions of the patron in solving many of the interests of the patients were assumed by the state. As a result of this, a situation has developed in which the attitudes of any patient who applied at least once to psychiatro-neurological dispensary were subjected to social discrimination, restriction of rights, and often judicide attitude on the part of society. The discussion of many legal issues which was conducted during 2-year preparation of the draft of law on psychiatric care in Russia showed that use of only legal norms and procedures in psychiatry cannot solve the whole variety of moral and ethical problems in the relationships of doctor and patient, patient and society and psychiatry. Therefore, it became necessary to develop a set of ethical norms, standards in psychiatry, and create ethical committees within the framework of the state and public professional psychiatric organizations. Professional ethics require utmost honesty, objectivity, and responsibility from the psychiatrist in making judgments about the state of the mental health. Often the difficulties of differentiation, the mental norms and pathology led to the formation in minds of both an individual and society as how the idea that even a very fact of going to a psychiatrist indicates that the person has a mental disorder, and this distinguishes him for the rest of life, for the rest of normal, so-called normal people. In order to improve ethical standards in psychiatry in our country, this work was continued by psychiatrists in collaboration with physiologists, lawyers, and philosophers. As a result, the Code of Professional Ethics of Psychiatrists was developed and adopted, approved by the Plenum of the Board in the Russian Society of Psychiatrists in 1994. The main goal of the professional activity of psychiatrists is to provide psychiatric assistance to anyone who needs it. The highest values for psychiatrists are the health and well-being of the patient. Any manifestation of superiority of the patient is unacceptable. In case of difficulties in process of providing assistance to the patient, the psychiatrist should seek assistance and advice from colleagues, and in case of similar treatment by colleagues, provide them. The psychiatrist has no right to violate the ancient ethical commandment, do not harm. If the examination or treatment is associated with side effects, pain, possible complications, or other negative phenomena for the patient, the psychiatrist must carefully weigh the risk of harm with the expected positive result. Psychiatric intervention is justified only when the real help to patient outweighs the possible negative consequences. Then conducting scientific research or testing new medical methods and means, the participation of patients, the limits of admissibility and conditions for their implementation must be predetermined. Psychiatrist has no right to disclosure without the permission to patient or his legal representative. Psychiatrist has no right to use medical methods and means to punish patient. Psychiatrist is obliged to respect the freedom and independence of the patient's personality. Psychiatrist should strive to establish the patient's therapeutic cooperation. Psychiatrist is obliged to discuss with the patient this problem of his mental health, and he should not promise the patient the impossible and obliged to fulfill the promise. Thank you very much for your attention. At this point, the lecture is over. See you at the class. Goodbye.